Okay, good morning, good afternoon, and good evening, everyone. My name is Sabine Rakoto-Malala, and I'm very honored today to be speaking about, with you and with colleagues, about Inspire 7 Strategies to End Violence Against Children. We're very happy because we have two speakers with us today. Dr. Regina Benvides, who works for the Centers for Disease Control for the Global Health Division of HIV and Tuberculosis, HIV and AIDS. And our second speaker is Assistant Secretary of the Operations Group for the Department of Social Welfare and Development in the Philippines, Mrs. Glenda Relova, and we're very honored. So we have Regina calling in from the United States, 3 o'clock in the morning, and Assistant Secretary Relova calling in from the Philippines. We'll have the presentation in 3 parts. I will first take 10-15 minutes to explain a little bit more about Inspire and the Inspire package. Then we'll have a quick session of answers and questions and answers. And then we'll have Regina and Dr. Assistant Secretary Relova presenting on the adaptation and scale up and how that happened in the Philippines. So without further ado, I will switch off my camera and give a short presentation on Inspire. So for those who don't know, we know today that globally up to 1 billion children have experienced physical, sexual, or psychological violence in the past year. This is information that we didn't have 15, 20 years ago. Today we have much more administrative data, and we also have the Centers for Disease Control that has been collecting household data. So 1 out of 2 children suffers from violence every year. And really, to make it very clear, this is something that we didn't know 10 years ago, and more we're uncovering this data. We also know that homicide is among the top 5 causes of death in adolescence. We know that beyond death, tens of millions of children are affected by violence in different ways. 1 out of 4 children suffer from physical abuse, often in the home and by people close to them. And 1 out of 5 girls is abused sexually at least once in her life. So these are important statistics for you to keep in mind, and also statistics that you can use when you're advocating within your country in terms of addressing violence against children as a huge issue. What do we talk about when we speak about violence against children? We speak about the different forms. So child maltreatment, which starts at very early age and continues until the age of 18. Bullying, which often can start at preschool, but throughout the school years. We speak of youth violence, often also referred to gang violence. Then intimate partner violence, also referred to as dating violence. So these are often intimate partner relationships that turn into violence. Then we have sexual violence, which happens from very early years until the age of 19. And then emotional or psychological violence. Here we also see witnessing violence. We know that a child witnessing violence in his or her household is just as impactful on him or her as actually suffering the violence himself. So imagine a child watching his father beating his mother would be just as impactful as the child being beaten him or herself. And also likely when the child is beating the mother, that there's also the child, him or herself, suffers from violence. What are the consequences of violence? Today, we see that there are different categories, the injuries, the mental health problems, maternal and child health, communicable diseases and risk behaviors, and non-communicable diseases. So, of course, the most obvious ones that we think of are injuries, fractures, burns, internal injuries that children suffer from. The more hidden types of consequences include depression and anxiety, post-traumatic stress disorder, suicide. We see unintended pregnancy, pregnancy complications. And then in terms of the communicable diseases, we see alcohol and drugs, HIV/AIDS, and sexually transmittable diseases. And then those in turn have an impact, an indirect effect on other non-communicable diseases such as cancer, diabetes, obesity, alcohol, smoking, and physical inactivity. So if you don't remember anything else from this presentation, I beg you to look at the slide, because the impact and the consequences of violence are much bigger than we see and we're often aware of. So to address this problem, because it's a big problem and we don't like talking about the problems, we would like to talk about solutions. Agencies over the past many years have been working in a very different manner. So if you would be speaking to UNICEF, maybe they would be saying, oh, to address violence against children, we need to work on response services and strengthening income and working with parents. And then you could talk to Save the Children and they would say, no, we need to be working on implementation of laws. And the WHO would say, we need to work on response services for victims of violence. UNODC would say we need to strengthen the justice sector. And so this was a little bit the way the landscape looked, with different organizations, different people saying many different things. And we know that in order to have a collective impact, we also need to have one voice. And so these agencies came together. Initially, it was the World Health Organization, UNICEF, CDC, UNODC, the World Bank, the Global Partnership to End Violence Against Children, Together for Girls, to try to agree on a set of key strategies. And these key strategies are the ones I'm going to walk you through. And throughout that, they were launched in 2016, which was the Inspire core package. And over the past 5 years, we've developed additional documents to support implementation of that package. And many other partners have joined this initiative. So when we look at Inspire, these are the 7 strategies that these agencies have agreed on. It's an acronym, so easy to remember, Inspire. We have implementation and enforcement of laws, norms and values, safe environments, parent and caregiver support, income and economic strengthening, response and support services, and education and life skills. And so today, it doesn't matter if UNICEF says, we're working on parent and caregiver support and education and life skills and response services, because they know that those are the 3 strategies that are part of a bigger package of 7. Or if a smaller NGO in, let's say, Tanzania is working on norms and values, that's also fine, because they know that this is one component of a package of other strategies that need to be implemented alongside. So the Inspire package brings together these 7 strategies. I would say it's a Trojan horse for some key things. The first one, it brings together the different sectors. So it shows the importance of the justice sector, the health sector, education, welfare, interior, finance. And so if you look at, for example, the first strategy on implementation of laws, the justice sector needs to be involved. The second one on changes of norms would often work through the health sector, education sector, and welfare sector. For strengthening the response services, which is the dark blue before last one, you would be working with the justice sector, the health sector, and the welfare sector. So it really is, Inspires a great to bring together the different sectors involved in the prevention of violence against children. Another very important component of Inspire is that the partners came together to find what was the evidence out there. So until today, and myself, having worked for NGOs for many years, people were setting up programs, not sure whether they were working, and then replicating them, and then scaling them up. And you would see anything from Scientology and football to ending violence against children to very evidence-based programs like parenting support programs or school-based violence programs. But the aim was really to bring together, at least to find what were evidence-based projects and how could those eventually be scaled up. So today in Inspire, you'll see that there's 48 projects, and they have a very short paragraph for each that cut across the 7 different strategies that have evidence, solid evidence behind them to show that if they're implemented in a certain way, that there is a decrease in the prevalence of violence against children. So the Inspire vision, you can see it here on the slide. It's a world where all governments, with participation of civil society and communities, routinely implement and monitor evidence-based and multi-sectoral interventions to prevent and respond to violence against children, to help them reach their full potential. So the 3 key words here are evidence-based. We really try now to scale up evidence-based programs as much as possible, or to ensure that programs that we already have can be improved to become evidence-based. The second one, multi-sectoral. As I mentioned, we bring together at the minimum those 4 key sectors: health, education, justice, and social services. And key to Inspire is also the concept of prevention. Of the 7 strategies, 6 of them are prevention strategies. So implementation of laws, changes of norms, working with parents, working in schools. Those are all prevention strategies. Until today, much energy and in most countries is put on the R, the response strategies, whereas we know that prevention, of course, will have a much bigger impact, so that we don't need to invest so much into the response services. So I'm just going to give you a glimpse of what's in the different Inspire strategies, to give you an idea of the evidence that's out there. So the first one on implementation and enforcement of laws, one of the projects mentioned is this one, which is in fact the introduction of a Firearm Control Act in South Africa. And over the 5-year period from 2001 to 2005, they saw introducing this Firearm Control Act, they saw a decrease of firearm homicides of 4,500 lives saved. So you would say, of course, you implement a law, then there's a decrease, but it's not always documented. And so it's great to see the evidence behind this, whereas we see that the non-firearms homicides stayed the same, the firearms homicides actually decreased. Another example in this strategy is the law on corporal punishment in Sweden, where in the 60s, they had, I think, 80–90% corporal punishment within the country. And by introducing a law on corporal punishment in the 60s, 70s, they today have, I think, a 5% of children that suffer from corporal punishment. So that's another example of a law that led to a decrease in the prevalence of violence against children. If we look at the N of Inspire, it's norms and values. An example of a project that we see is a project called SASA, which was set up initially in Uganda, but then has been expanded to 10–15 countries in Canada. And this is a project targeting intimate partner violence. As I mentioned, a child that witnesses intimate partner violence is likely to suffer from intimate partner violence in the home, or at the least be impacted by the intimate partner violence. And so this is a community mobilization program where health community workers go into the households within the community and discuss the gender relations within the household. And so we see here a decrease in the prevalence of violence against children of 64%. So children witnessing the intimate partner violence reduced by 64% due to this actually quite simple community mobilization program. Another example, another strategy, the third strategy is safe environments. And here we look at something called the Cardiff approach, which might be interesting for the German colleagues online. Here we see the importance of crossing data. And here this is data from police offices and hospitals, where they looked at where were the hotspots, where was the violence occurring in the city of Cardiff. And by assessing the data, the police admissions and the hospital admissions, they were able to set up community support at the right times of the day. They started within the evenings when people were going out of pubs, and in which neighborhoods exactly. And there were community workers or community police officers that were supporting young people to decrease the violence. And what did they see? Thanks to the implementation of simply crossing data and getting the right people to the right place at the right time, they saw a 32% decrease in police recorded woundings and a 42% decrease in hospital admissions. Another personal favorite within this strategy that you can see in Inspire is something called Cure Violence, where they see that they have community interrupters that see issues of violence and immediately work with the two people that are involved in the violence to mediate and calm down the situation. And they've seen up to 80% decreases of violence. And the Cure Violence program was set up in Chicago, but it's today rolled out in countries like Honduras, El Salvador, Syria, Central African Republic, across the world. So hopefully you're starting to see that ending violence against children is possible. We have data to show it, and there's serious decreases in prevalence. Another key strategy is parent and caregiver support. Here we talk about the Nurse-Family Partnership Program, which was in the US, but in fact is used in many countries in Eastern Europe, in the Netherlands, and where nurses don't only go into checking the weight of the child or how the child is doing, but in fact from pre-pregnancy they create a link with the parents, understanding how the situation is, and then follow the parent in the first few months after the child is born to detect any possible violence in the household, but also to support the parents. How are the siblings doing? How is the relationship going? And there they actually tracked the families over a 15-year period, and they saw that the families that received this support from the nurse-family partnership showed a 48% decrease of violence compared to those that didn't receive the intervention. So again, parent and caregiver support, I think it's probably the most used strategy. There's many other projects that are showcased in Inspire that show a huge decrease of violence against children. Today, with the COVID situation, we in fact see that it's more important than ever to give this parent and caregiver support in order to decrease domestic violence in situations where children are at home, sometimes with the perpetrator, or where parents are more stressed and are becoming more involved with children, and the children are suffering more violence. The next strategy is income and economic strengthening. And in fact, interestingly, we see that if you combine income and economic strengthening with parents, you see a much higher decrease of violence against children, which is interesting both for this strategy and for the previous strategy. But the project that I'm focusing on now is called Image. And here it's a very simple microfinance and gender equity program. So women received microfinance, and at the same time were held discussions around gender equity in the household, how you can deal with the household, how women manage the household budget in discussion with their partners. And these discussions in terms of the gender, in addition to the income and economic strengthening, led to a 50% decrease of intimate partner violence. The sixth strategy that we're looking at is response and support services. So we see in this example that trauma-informed cognitive behavioral therapy for children that have already suffered violence is very impactful in terms of reducing the trauma symptoms and the functional impairment over time. So children that received individual therapy had a 32% decrease of trauma symptoms, and the children that received group therapy, in fact higher than the individual therapy, showed a 42% decrease of trauma symptoms and functional impairment. So once they had gone through the 11 sessions of cognitive behavior therapy, we saw this decrease of symptoms. Again, in the Inspire Handbook and Inspire Core Document and Handbook, you'll see much more information on how you can do detection of cases, referral, follow-up, and this type of services that help for children that have already suffered from violence. The last strategy that we look at, and this is in fact shown to be the strategy that's the most widespread, is working with children through schools. And so the example that we see here is a program for decreasing disruptive behavior in school settings by providing life skills to and social emotional training to these children. And so they saw that there was a 25% decrease if it was given to all students, and a 33% decrease if it was given to a select number, I would say, of naughty students. So the reduction in aggressive and disruptive behavior was actually quite enormous. I live in Switzerland, where they also more and more in schools are rolling out these programs for all students. There's an excellent other example, which is called Kiva from Finland, which shows even higher reductions of violence within the school, thanks to the life skills and socio-emotional learning. So I've walked you through the Inspire core document, and I really went through it very quickly, but I suggest you have a look at it. It's only 55 pages, the core document, and it gives very interesting, simple examples of the 7 strategies and the different interventions within those strategies. But very quickly, we had NGOs come to us and say, but how are we supposed to do this? We have our programs running for many years and we're not able to change them, or it's not one of the programs in Inspire, so what should we do? So we developed this Inspire Handbook, which gives much more detailed guidance on how they can adapt their strategies and think them through and how they can find reference to the existing project so that they can better inform the new projects as they develop them. The Inspire Handbook gives information on, for the different projects, who are the appropriate populations, what are the core components that will ensure that the project works, what are the costs associated in terms of human and financial, and where can I get the manuals and trainings, and where has it been implemented and what has been learned from other countries. It has some implementation worksheets to make you think through how you can, as you think through the implementation of those core programs. And then we also developed an Inspire indicator framework so that you can actually start tracking not only whether there's a decrease in the prevalence of violence against children thanks to your program, but also outcome indicators, whether your program is working the way it should be working, and what you should be putting in order to get the outputs. So for each of the Inspire strategies, you see indicators, what are some of the data sources, the definitions, sample questions to assess whether your project is doing what it should be doing. The Global Partnership to End Violence Against Children is working in, this is a slightly old map, but today we're in 37 countries that are high, middle, and low income. They range from Canada and Japan to Brazil, Honduras, South Africa, Tanzania, Cote d'Ivoire, Nigeria, Montenegro, Romania, and we're really trying to support them in the implementation and the scale-up of Inspire. So we have this package of Inspire tools. We have tools for monitoring. We have a strong partnership because now we work together, I would say, on a weekly basis with UN organizations, with governments, with civil society organizations to achieve this collective impact. We're communicating, we're singing from the same song sheet. So we know what are the 7 strategies, how should we be doing scale up, what are the indicators to measure them. And we have the political commitment, which are the Sustainable Development Goals 16.2 and other related goals. And of course, the Convention of the Rights of the Child. So we really have everything in place to achieve collective impact. I've gone through this quite quickly because I really want to hand over to my colleagues, Dr. Benvides and Dr. Rovas, because they will be able to tell us how we can now, in fact, scale up Inspire strategies in theory and in practice. So before handing over to Dr. Benvides and to Assistant Secretary General Relova, I'll maybe take some questions. Are there any questions? And Regina, otherwise you can take over the presenter. Hello? Is anyone still there?
Okay. Yeah, okay. Good morning. Good morning, good afternoon, good evening. Thanks, Sabine. And well, I'm Regina Benevides. I work for the Center for Disease Control and Prevention based in Atlanta, United States. And CDC has joined these other partners, as Sabine was mentioning, in this effort to create opportunities for us to work together to end the violence against children. So what I will go through now is our most recent tool, but actually our new, and it's going to I'm saying new because it's going to be launched this week. It's our Inspire Guide to Adaptation and Scale Up. But before that, and I will stop my camera to go through the presentation, I would like to be sharing with you a few thoughts on how we got to this point. So Inspire, as we've heard from what Sabine has just mentioned. Actually, I'm trying to change the slide, Sabine. Next. Okay, fantastic. You're going to do it. Thank you very much. So Inspire, as we've heard, is a groundbreaking attempt to globalize the end of violence against children. For us, 2 elements stand out: the insistence on a strong evidence base for advancing interventions, and the comprehensive multisectoral definition of the problems relating to violence against children. In speaking of the multisectoral nature of violence against children, we raise a very important topic, complexity. A quarter century ago, programs were commonly contained with professional and disciplinary sectors. For example, primary education, jobs training, family planning, etc. They were designed and managed by individuals with deep but specialized sectoral expertise. Secondary elements from different sectors might feed into such programs, but those elements intersected with the dominant sector in target ways. As Sabine has suggested, of course, violence against children does not permit this kind of sectoral approach. In addition to the challenge of multisectoralism, however, is the challenge of bringing the Inspire approach to scale by adjusting it to the realities of countries around the world. The need to contextualize a multisectoral approach to permit scale up creates a kind of complexity that begs for adaptation. So what do we mean when we talk about complexity? A simple model, the previous one, Sabine, just a little, yeah. A simple model of complexity might look at three dimensions: the contextual, the temporal, and the interpretive. The contextual dimension is essentially what we think about most often when we think about complexity. All the different variables of programs, including budgets, policy, local infrastructure, community needs, etc. But the temporal dimension is also something we consider when pressed. As situations and interventions evolve over time, contexts change in ways that are predictable and unpredictable. But a final dimension of complexity that most often we don't talk about is what we call the interpretative. It's a less commonly recognized, but formally important dimension of it. And it's one with which we are almost less familiar with. It's the fact that every actor and stakeholder in a situation is perceived and interpreting any given problem differently from a number of reasons, and importantly, acting on the basis of those perceptions. Putting these three dimensions all together, we see programmatic activities are not only complex because there are so many elements of a situation's context that are constantly evolving over time, but also because our ability to share and assess them with others is dependent on perception and interpretation. Next, please. So, Inspire activities are not only complex because there are so many elements within each country's context that are constantly evolving over time, but also because the ability to share and assess them with others is dependent on perception and interpretation. Next, please. Such complexity means that Inspire must meet the needs of different countries and local contexts in flexible ways if it is to successfully take root. So there is clear a logical progression from complexity to the need of adaptation if one is to scale up a program in a sustainable way. And this was the approach that Inspire took to get to this other point that we are now, which is to develop an adaptation and scaling up Inspire guide. We do need to understand that not only because violence is complex, but it demands adaptation, constant adaptation, and demanding adaptation. It's what allows us, permits us to scale up. You may notice in this slide that when we are talking about this relationship between complexity and adaptation, it's kind of something that is an emergent situation. But when we think about going from adaptation to scale up, we really need to develop a deliberate process. And this is an important point for us at Inspire. So next. Okay, After Inspire has set out its evidence-based and multi-sectoral vision, the Inspire Working Group decided that it was critical to take its approach to the next level, focusing on how to adapt, scale, and sustain successful interventions to strengthen systems and increase program coverage. We enlisted the assistance of two consultants, Joseph Petraglia from Sintegro and Rebecca Lundgren from the University of California, San Diego, to create a web-accessible and downloadable guide to adaptation and scale-up. The development of this guide was undertaken with the active assistance of pilot pathfinding countries and Assistant Secretary Grenda Rilova from the Philippines government will speak on this process shortly. The guide seeks to strengthen capacities for adaptation and scale up while providing the tools necessary to disseminate the Inspire approach globally. I'd like to invite you to take a quick tour of the guide. And as I told you, this guide will be launched this week. That illustrates how Inspire is supporting governments to coordinate the 7 strategies for ending violence against children in a way that makes sense for their circumstance. So I think, Sabine, you can give me let me try now. Let's see if I'm going to do it right. Okay. Good. Wait a minute. Here. Okay. Okay. Oh, I'm sorry for that. And I think it's okay now. Okay. Is it already there?
No, Regina, I think it always takes, yeah, it's coming.
Okay, good.
Yeah, now it's on.
Fantastic. So this is our website of the guide to adaptation and scale up. And I want to just go through a very quick tour so you can have a taste of how it will work. So as I was telling you, the guide has 5 modules. Here, 5 modules. And each module has tools to strengthen capacity in adaptation and scaling, as well as helps to apply that capacity to local realities. So as you can see here in the bottom of the screen, Module 1, the basics. I'm going to click on it. I hope it works well. So the basics has, as the name suggests, the basics on adaptation and scaling up. So the goal of this module is to make sure that we can create a common language and thinking among the different members that are working on a violence against children action plan. It sets the stage in terms of key definition and elements of adaptation and scaling up. It has 6 tools that help the user to understand the basic principles of adaptation scale up. If you click here, find the module. Okay, so this is the basics. Number 2, making choices. So after everybody has developed this common language and thinking about adaptation and scaling up, we go for the module 2, which is making choices. And this module helps to set priorities and criteria for building a resource team, as well as for selecting activities to scale up. Questions that users will need to ask themselves in this module are: what activities should be prioritized for adaptation and scaling up? Who will support the scaling up of violence against children activities? This module has 3 tools. And I want to show you, just as an example, one of these tools. Let me go here, go to Model 2. Okay. Model 2. Tools. Okay. I'm going to give you just one example of one of the tools, which is a very important one, tool 2B, which is the evidence profile. This tool is what we call an evidence mapping tool. It asks users to identify interventions they are considering adapting and scaling. It then guides them in digging deeper into the evidence-based supporting each intervention and answering questions such as, how has this intervention been evaluated? What methodologies were used? What are the findings of effectiveness, and how credible are those findings? Or whom have made them credible? What was the approach that was taken to make this intervention, that, for example, the country is interested in adapting and scaling up, to be evidence supported? This tool, 2B, is critical to this guide, as it emphasizes the importance in inspiring of grounding the selection of scaled violence against children interventions in evidence. Let's go to module 3. Okay. So after that, module 3, here, the name of the module is kind of cute. Will it fit? How will it scale? This module helps the user to anticipate the potential for fit or suitable adaptation of model activities into future target sites, and how to set realistic benchmarks to stay on track. It highlights the importance of ensuring that two main types of scale up are in place. What we call the horizontal scaling up, which is like really expanding the intervention, and the vertical scale up, which is to institutionalize the intervention. Both dimensions of scaling up are crucial to make it a sustainable process. This module has 4 tools. And finally, number 4, I skipped one. Number 4, oops, okay, let's go back to number 4. I'm sorry, find the module. I hope it's working well. Okay, go to module 4. So module 4, leading and learning, discusses strengthening understanding of the core principles of each intervention. It also discusses the use of adaptive capacity and management techniques and documentation and learning from the adaptation and scaling up process. Key elements of the adaptive process are discussed, like the difference between core and peripheral elements of a practice, adaptive management, and how to monitor and document learning to help for future implementing partners scaling up activities. It has 3 tools. And finally, module 5 here, advancing your strategy. In this module, the last one in the guide, the focus is on sharing progress with partners and stakeholders to advance countries' scaling up strategy. As it is highlighted throughout the guide, adaptation and scaling up is an ongoing process. It really never ends. Even as you scale, you are preparing to scale even better and further, right? So it's an ongoing process. So people that are involved in the adaptation and scaling up process, they have to be constantly assessing the process and trying to do better and trying to go further. This module, number 5, it has 3 tools. And I'd like to show another one very important tool in this module, number 5C. Let me go here. Okay, 5C. which is very important for the process of a sustainable scaling up process. And it's called pulling in the same direction, a cross-sectoral review. Just as in the previous tool that I showed you, the 2B, this also emphasizes the importance of evidence in Inspire. This tool 5C supports the cross-sectoral nature of the Inspire approach. Early in the guide, countries are asked to look at their violence against children action plan and identify the preconditions, which means those things that need to be in place to reach the plan's goals, and the risks, which means those potential obstacles towards reaching the plan's goals. These lists of preconditions and risks are now revisited, and in a plenary of Inspire partners, they are asked to report on how their activities are either putting those common preconditions in place or mitigating the common risks identified. In this way, partners working in different sectors can show the national coordinating team the ways in which they are pulling together to reach common goals through independent activities. The guide's web-based version allows the user to move at her own pace, making his own decisions about which tools will be most helpful to his or her context. The guide, modules, and tools can be downloaded as PDF and are easy to be printed and reproduced. It is going to be in English, and by the end of July, we'll probably have it available in Spanish, French, and Khmer. In total, the guide has 19 tools, but as the guide says, not all tools will be useful to everyone. The tools are designed to help country teams to apply an adaptation and scaling up lens to their violence against children action plan. Select activities that can be successfully scaled and coordinate adaptation and scaling up across sectors with stakeholders and implementing partners. The guide encourages coordinating committees to review the guide, to consider the goals of each tool and prioritize those that are useful for their context. Okay, now that I presented what is the guide is about and how to use it, I'll give the floor to Assistant Secretary Rilova from the Philippines government to share with us how the guide was developed and what was the contribution of the countries to the guide, and to tell us how the country is moving forward its action plan to end violence against children. Thanks for your attention.
Okay, thank you, Dr. Regina. So, good afternoon here in the Philippines. And greetings from Manila. I am Glenda Direlova, Assistant Secretary from the Department of Social Welfare and Development. The Philippines Plan of Action to End Violence Against Children, or PPA-EVAC, is the Philippine government's national interagency response to end the increasing cases of violence against children. It is a 5-year plan that started in 2017 and will end in 2022. The Philippine Plan of Action to End Violence was launched in May 9 of 2018 and was endorsed by no less than the President of the Philippines, supported by the Secretary of Department of Health, Department of Education, Department of Social Welfare and Development, Department of Interior and Local Government, Department of Justice, Commission on Human Rights, UNICEF, and Consuelo Sobel Alger Foundation. Next slide, please. The population of the Philippines in 2015 was at 100,981,437, about 21% from 92,335,113 in 2010, growing by an average of 1.7% yearly. In 2010, about 40% of the total population were children. 51% were boys, while 48.5% were girls. The Philippines indeed had and continue to have a large population of children. The results of the 2015 National Baseline Study on Violence Against Children, conducted by the Council for the Welfare of Children with the support of UNICEF Philippines, underscored the high prevalence of violence experienced by Filipino children in their lifetime, whether it happened at home, in school, in workplace, or community. The baseline study showed that 80% of the 3,866 Filipino respondents aged 13 to 24 had experienced any form of violence in various settings. 66.3%, or 3 in 5 respondents, were reported having experienced any form of physical violence in any setting, while 59.2%, or 3 in 5 respondents, reported to have experienced some form of psychological violence in any setting. 22.4%, or 1 in 5 children, reported suffered sexual violence in any setting. About 48.8% of respondents reported to have experienced cyber violence. Among children aged 13 to 18 years old, or 33.6%, encountered multiple abuse in the form of physical and psychological harm, and 13.7% had all 3 types of polyvictimizations, namely physical, psychological, and sexual violence. Next slide, please. The Philippine Plan of Action to End Violence Against Children, or the PPEVAC, is based on the Philippine experiences of existing programs and planned innovations. This PPA-EVAC is guided by Inspire 7 strategies for ending violence against children, which are implementation and enforcement of laws, norms and values, safe environments, parent and caregiver support, income and economic strengthening, response and support services, education, and life skills. Next slide, please. In this slide, you will find the 6 key results areas of the Philippine Plan of Action to End Violence, the lead government agency, and the key strategies. So in this key results area, you will see the whole of government and the whole of nation approach in fighting violence against children. The key result areas, or the KRAs, are KRA1, parents and caregivers are aware of practicing evidence-based parenting and positive discipline. The lead agency is our agency, the Department of Social Welfare and Development, or the DSWD. The key strategies, the promotion of evidence-based, age-appropriate, and gender-responsive parenting programs, capacity building, communication for behavior change, awareness raising on responsible parenting and family planning to promote positive discipline in parenting has been identified by the Commission on Population and the Department of Social Welfare and Development. Key results area number 2, which aims for children to demonstrate personal skills in managing risk and challenges and protecting themselves from violence. The lead agency is the Department of Education. The key strategies, the integration of age-appropriate life skills and personal safety lessons in the curriculum and in the communities. In 2009, the Department of Education institutionalized the use of personal safety lessons in both elementary and secondary schools nationwide, with the view of creating a friendly environment at the school level. Further, the Department of Education crafted the Comprehensive Sexuality Education Framework Policy, which contains core topics and subtopics of nurturing positive values and life skills among learners. Key results area number 3 states that all victims of violence against children have access to appropriate, quality, protective, social, mental, health, legal, economic, and judicial services. The lead agency is again our agency, the Department of Social Welfare and Development and the Department of Justice. The key strategies, the development of comprehensive multi-sectoral protective mental health, legal, economic, and judicial responses plan on violence against children, and a structure for its implementation, which includes capacity building, a unified child protection information management system, and a helpline. In the Philippines, we have established the Women and Children Protection Units, which is retained by the Department of Health, the Juvenile Justice and Welfare Council, which is an attached agency of the Department of Social Welfare and Development. Helpline are available for reporting cases of abuse, exploitation, and violence, such as the 24-hour crisis intervention units and a quick response team. Key results area number 4, which aims to have a well-developed and effectively managed monitoring and evaluation system for the PPA-EVAC. The lead agency is the Council for the Welfare of Children. The key strategy is the development of an integrated results-based monitoring and evaluation mechanism, and a dedicated team or division will now be handling this monitoring and evaluation. Key results area number 5 seeks that all VAC-related laws are in place and effectively enforced. The lead agency is the Council for the Welfare of Children. The key strategy is the localization of national laws and frameworks. Legislative advocacy, setting up of monitoring mechanism on the implementation of relevant laws. The Department of Education finalized the National Policy Framework on Learners and Schools as Zone of Peace, which had been prepared and supported with full documentation of good practices in schools in mitigating the risk of armed conflict to children. The Barangay Protocol in managing of cases of children at risk of the Department of Interior and local government. And then the last one is the key result area number 6, aspires that multi-stakeholders child protection structure and systems at the national, provincial, municipal, city, and barangay levels are operational and effectively functioning. The lead agencies in this area are the Council for the Welfare of Children and the Department of Interior and Local Government. The key strategies is the strengthening of the national network in ending violence against children, or the NENE-EVAC, mobilization of faith-based organization and private sector. According to the Department of Interior Local Government, around 88% or 37,178 of more than 42,000 barangays in the country have already established their barangay violence against women's desk. Next slide, please. As discussed in the previous slide, the PPA-EVAC is guided by the Inspire. The 7 strategies of Inspire is present in the 6 key results areas of the PPA-EVAC. Implementation and enforcement of laws, guide 5, all violence against children-related laws are in place and enforced. Norms and values guides KRA 1. Parents and caregivers are aware of practicing evidence-based parenting and positive discipline. Safe environment guides KRA 5 as well. Strategy on income and economic strengthening, response and support services, and education and life skills guides KRA 3, 6, and 2, which are all children have access to appropriate and quality services, child protection systems at all levels are effectively functioning, and children adolescents demonstrate skills in protecting themselves from violence. Next slide, please. The government of the Philippines contributed to the development of the 6 modules on the Inspire Guide from December 2020 up to February of 2021. Weekly meetings were conducted with national government agencies and member civil society organizations from the National Network to End Violence Against Children, the country coordinating body to implement the national plan. Next slide, please. Dialogues and critiques were conducted in Zoom calls. So given the limitation in movement, all meetings have been conducted through Zoom among consultants and the NENEVAC, or the National Network to End Violence Against Children representatives, which focus on national coordination relating to topics in the modules. Conducted in line in which strategists focal persons offer their insights into the technical and contextual context of the module. Next slide, please. Another task is to develop inclusion criteria for evidence-based violence against children interventions. The Philippines contributed 11 examples of VAC interventions from prevention to response covering the Inspire strategies. Example of these interventions will be covered in the next slides of my presentation. The interventions contributed to the overall sampling of evidence that is available in pathfinding countries. Next slide, please. So here I will show you some of the examples of VAC interventions in the Philippines. So the Philippines has been decentralized since 1991. And for a national plan to be implemented, it must be localized or down to the grassroots. The development of the toolkit relied heavily on the experience of 3 local governments in localizing the PPA evac with CSOs, the Council for the Welfare of Children, and UNICEF supporting their efforts. For 2021, the toolkit will be rolled out and 10 more local governments are targeted to localize to further enhance the processes involved. Next slide, please. The DSWD's training of parents and caregivers on positive discipline for everyday parenting. For 8 years, the training program aims to capacitate caregivers and parents of forms of alternative disciplines they can use and prevent and stop corporal punishment at homes. This is integrated in the family development sessions on which attendance is a conditionality in the government's conditional cash transfers or 4Ps. Parenting effectiveness seminars, which is conducted in daycare or child development centers and in alternative care settings. Parenting for lifelong health is currently being adapted to the Filipino context as Masayang Pamilya or MAPA or Happy Family. Next slide, please. Women and Children Protection Units, for 24 years, WCPUs have been providing protection services on case management, medical and mental health for women and children survivors of violence. We also conducted establishment is led by Child Protection Network Foundation in partnership with the Department of Health and the local government units at the province level. The original site has grown to 113 WCPUs nationwide in 57 provinces and 10 independent cities. However, there are 81 provinces in the Philippines, and the target is to set up one in those without WCPUs. The Philippine General Hospital, the biggest hospital in the Philippines, CPU is now adopting case management to teleconsultations to ensure continuity of service during the pandemic. Next slide, please. The Department of Education Child Protection Policy in time of COVID-19. Since 2012, DepEd has adopted the policy to provide special protection to children who are gravely threatened or endangered by circumstances which affect their normal development. In 2020, a supplemental policy was drafted to ensure that children are protected in the context of home-based learning and that DepEd teaching personnel trained on identifying, preventing, and responding to child protection issues. Next slide, please. What are our ways forward? Our ways forward is to develop or enhance an action plan to accelerate the implementation of the Philippine Plan of Action to End Violence Against Children. We will also strengthen the national network to end violence against children, to include the high-level leadership and the economic sector, to include the National Economic and Development Authority, Department of Finance, Department of Budget, and the Philippine Statistics Authority to ensure fiscal sustainability of all programs and services to end violence against children. And we also have to plan to implement the Inspire Guide to Adaptation and Scale Up in 2021. Next slide, please. So at this point, I guess this is my last slide. I would like to thank everyone in the Philippines. Maraming salamat po, or thank you. On behalf of the Secretary of the Department of Social Welfare and Development and the Philippine government, the Philippines has been and will always be in the service of the Filipino children. Good afternoon, and thank you.